I think of product really as a function of how we bridge the gap between the needs of our clients, what's happening in the industry, and how we can serve the employees who receive CareATC care. So our product team's job is to really bridge that gap, help with the sensing of what's happening in the industry, the scoping of how we bring that product to our clients, and then ultimately the delivery and management of those offerings, ensuring that we're achieving the highest quality care and in serving as many patients as possible. We live in a day where people have access to tons of information and they're constantly inundated with recommendations, whether it be through social media or quick research they use, and now even AI chatbots. We use technology to actually put people in contact with the person who knows them, their PCP, building that connection, somebody who can look beyond just an initial data insight and say, I've known you for a lot of time, here's what I think we need to do about your health.
Over 10 years ago, we built our own enterprise data warehouse at CareATC, and that was the beginning of now what we call our PowerOn platform. It's industry-leading tech stack. It houses a tool we call CareHub. CareHub is a tool that allows our providers, with one click of the button from our electronic medical record, to see over 2,400 data points on each patient. And there are gentle reminders in that tech stack that allow the providers to circle back on maybe chronic conditions that have not been addressed by that patient.
CareATC's PowerOn platform allows us to do thousands of virtual visits a day, connecting people in rural areas who normally wouldn't have access to high-quality primary care, as well as physical therapy, mental health, and health coaching services. The average rating a patient gives CareATC's virtual experience is 4.9 out of 5 stars, and we see an incredibly low industry-leading no-show rate compared to our competitors. The other thing we use is a lot of data. We recognize that there's a bunch of information in our employers' claims, and we're always analyzing these claims to make sure that we're meeting the needs, whether it be directly through a CareATC offering or through a partnership on something like infusions to help reduce the overall cost of care that continues to rise as services get more expensive and more complicated for employers to navigate. A really powerful story I heard recently was about how our telehealth visits have increased access for a rural population in Oregon. There was a patient there who had been seeing one of our doctors in Utah, and because our longer visits gave them space to have additional discussions, our doctor was able to diagnose them with bipolar disorder. It's something that they had been seeing other people for, but because the average visit length is 7 minutes, they weren't diagnosed with. That diagnosis led to the appropriate pharmacy treatment, and ultimately that patient's experiencing a higher satisfaction and actually more engaged in their health and continuing to see follow-ups with that provider. So this isn't just using technology to connect people face-to-face, but also giving access to those rural populations, to those people who might not have access to care in a traditional setting.